Hometown Radio, 1580 KGAF presents the Community Service Report. Here is Dee Blanton.
Thanks very much. Hi again, everyone. Welcome to our Thursday Community Service Program. Today, Muenster Memorial Hospital Day. Very happy to be joined by Yvonne Ambrose, a certified nurse practitioner at the MMH Family Health Clinic. Hi there, Yvonne. How are you?
I'm fine.
It's good to see you.
Thank you.
And it's good to have you on the program, certainly. I guess before we get started, tell us a little bit about yourself. I know tons of people know you around here pretty well, but tell us about yourself and a little about your background.
Okay, well, I'm, of course, a nurse practitioner at Muenster Hospital Family Health Clinic, and I've been practicing there since 1998. Before that, I was a critical care registered nurse, worked primarily at Denton Regional Medical Center, which I think most people know. But I'm married and have 3 children and 6 grandchildren and enjoy horseback riding, so I'm pretty active.
Well, it sounds good, and it's of course the Muenster community and everyone else who uses the family health clinic there in Muenster is very lucky to have all of the staff there, especially you and the folks that take care of them so very well. We're really fortunate to have that. Now, you're here because September is National Cholesterol Education Month. Now, first, is there a month for every single thing in the medical world?
I think there's months for everything, yes.
Medical or not, actually.
Right.
But September, National Cholesterol Education Month.
Right.
Now, the Million Hearts Focus is kind of the theme this year, I understand. And this is kind of spearheaded by the Health and Human Services Department. Is that right?
That's correct. The National Cholesterol Education is a part of the national effort to prevent 1 million heart attacks and strokes by the year 2017 in the United States. And it is called the A Million Hearts. And what it does is it's focusing on the ABCs of cardiovascular health. And the A is aspirin when appropriate, and B is blood pressure control, and C is cholesterol management and smoking cessation.
And we're going to concentrate on cholesterol, the C of the ABCs today on the program. And first of all, tell us, because you hear all sorts of things in this world and it becomes confusing, so kind of narrow it down and tell us what cholesterol is.
Well, cholesterol is a waxy, fat-like substance that is in what your body actually needs for good health. But when it's in excess amounts and you have certain risk factors, it is something that will build up in your arteries and actually cause cardiovascular disease, heart attacks, and strokes. So there's 71 million Americans that have high cholesterol, but only 1/3 of those 71 million Americans have it under good control.
And we hear the term good cholesterol and bad cholesterol. What is the difference in those?
Well, when we do a lipid panel, which is a cholesterol screening, the 2 main components that we look at are the LDL, which is the bad cholesterol, the low-density lipoproteins, and the HDL, which is the good cholesterol, the high-density lipoproteins. So the LDL is what we're mostly concerned with to monitor and to control, either through lifestyle changes, and risk factor adjustments and or medications if we need to.
And why is it important? I mean, that's kind of a broad question, but why is cholesterol important and at the same time dangerous to us?
Well, cholesterol is used to make, say, for instance, it's a part of our certain hormones that our body uses to work in your thyroid and all your other testosterone and women's hormones. But if you have an excess amount of cholesterol, the bad cholesterol will build up in your arteries. And if it's allowed to build up long enough and you have other certain risk factors, it will occlude your artery, and then it will cause like a heart attack or a stroke.
So why campaign? I mean, most of these campaigns are simply to raise awareness, and I would guess this is not out of that vein.
Well, in September is the month that we want to educate people to get out and get their cholesterol checked. If you're over the age of 20, you should have your cholesterol or your lipid panel checked every 5 years. If you have other risk factors, you might want to do it more often. If you're a man over the age of 45, you probably would do it more often. If you're a woman over the age of 50, you should probably do it more often. If you're a diabetic, you should start doing it at the age of 40 every year. And other risk factors, which include smoking, puts you at a higher risk for heart disease, of course, diabetes, and having high blood pressure. Or if you have a first-degree relative that have had an early heart attack or stroke, you certainly want to be in to see your healthcare provider and be assessed for your risk factors.
All right, let's talk now about the treatments for high cholesterol. I know there are drugs out there that folks can take that'll help, but talk about other treatments too.
Well, the main thing you want to do is you want to eat a healthy diet. Okay, so you want to eat more fruits and vegetables, and you want to reduce your saturated fats. And saturated fats are basically those fats that basically become solid at room temperature. So your meats and stuff like that. You need to exercise regularly, and it's recommended by the Surgeon General that you exercise in a moderate to an intense exercise for 2.5 hours every week. And maintain a healthy weight. Being overweight or obese can raise your cholesterol levels. And, of course, losing weight can lower your cholesterol. And not smoking. So if you smoke, quit as soon as possible. And there are a lot of different methodologies to help people quit smoking if you're having trouble quitting smoking. So, as I say, go back to your healthcare provider. They can help you if you can't quit on your own.
Yeah, I know I've run across people smoking and say, you need to quit smoking, and they immediately say, well, you need to quit eating. So, either way, we're kind of stuck there in that regard. But it is a very, very important thing. Now, I do just want to go back and touch a little bit on the A's, because the A of the ABC you mentioned is aspirin when appropriate, and seems like a lot of doctors are prescribing the low-dose aspirin on a regular basis, whether or not someone's had a first heart attack. Used to, we always heard it was after a heart attack, take the aspirin to try to prevent a second. But now it seems a lot of people, me included, have been ordered to take a low-dose aspirin. Does that actually help? I know it thins the blood just a little bit, but does that actually help guard against high cholesterol?
Well, it doesn't guard against high cholesterol, but it does help with the aggregation of platelets. So people that have high blood pressure, and probably if you're over the age of 40 and you have high blood pressure, you probably should take an aspirin every day. Obviously, those people that have problems with their stomach or sensitivity to aspirin probably will not be able to take it. But even if you take a baby aspirin every day, it's probably indicated to go ahead and take an aspirin to help prevent that clotting, platelet aggregation. So yeah, it's become a standard of care pretty much to go ahead and take an aspirin. And sometimes you can just even take it a couple times a week.
Mm-hmm. Yeah, because I know that a lot of times if you're having surgery, they'll tell you to stop taking it before you're going to do that, right. Because they want your blood to be able to clot for sure. But I know that is important. I just wanted to ask about that since it is kind of included in the ABCs of cardiovascular health. So again, are you doing anything in particular in the family health clinic there in Muenster this week to raise awareness of cholesterol?
Well, we do screen every patient that comes in when they're new patients, and then annually when we have patients that come in for their blood pressure, annual blood pressure evaluation. We screen them for their cholesterol annually and more often if we need to. And then we evaluate them if the patient's having trouble lowering their cholesterol on their own, either through diet, exercise, and they can't seem to do either or, which some people we have more trouble with others. Mm-hmm. then we will go ahead and put them on medications to treat it. Statins are probably the most widely used and probably the best treatment for your high LDL cholesterols, and probably the most well-known. And so that's an ongoing thing for us. So I think we have an article in the paper this month about the education for cholesterol awareness.
All right, excellent. Well, it sounds like you're certainly busy educating folks, and of course, we would like to remind folks to be aware of your cardiovascular health, be aware of your cholesterol numbers, and if you need to get those checked, maybe you don't have a doctor, family doctor, well, go see the folks over at the MMH Family Health Clinic, and they will take care of you. Yvonne, thanks so much. I know you're busy. Well, I know today you're actually not as busy as usual, but thanks for coming in today anyway. All right. We appreciate it very much. She is Yvonne Ambrose, certified nurse practitioner at the MMH Family Health Clinic. That's going to wrap it up for our Thursday program here on Hometown Radio 1580 KGAF.